Good morning. The December 15th, 2020 council meeting is called back into session. Do we have any unfinished business to add to the December 15th agenda?
Madam Chairman, I'd like to suspend the rules to discuss a resolution in support of the County Health Department's most recent declaration.
I need a second, please, to suspend the rules.
Dr. Warren, are you saying you want to suspend the rules to add that item for consideration as item number, I believe, 49?
Yes, ma'am. Let's suspend the rules to add item number 49.
Second.
Thank you.
Thank you. Dr. Warren, will you please introduce that item? Well, we're going to vote on it first. Madam Comptroller, will you please conduct a roll call for suspension of the rules?
Councilmember Canali, Carlisle, Vice Chairman Colbert,
Yes.
Easter Thomas,
Yes.
Ford,
Yes.
Johnson,
Yes.
Jones, Logan, Morgan,
Yes.
Smiley, Swearingen,
Aye.
Warren,
Aye.
Chairwoman Robinson.
Aye. That motion passes. Thank you. Dr. Warren, will you please introduce your item? Item number 4. No, let me, sorry. Madam Comptroller, will you please introduce item number 49?
Item number 49 is a resolution supporting the Shelby County Health Department issuing a safer at home order. This resolution is sponsored by Councilman Warren, and there is a request for same day minutes.
Okay. Dr. Warren, will you please move this item?
I would like to move item 49.
Second.
Thank you. Dr. Warren, will you please elaborate on this item? If you have anyone that has a presentation, you can do that now.
Yes, ma'am. I'd like to give a brief, very brief background for people. And then I have Dr. Jane and Dr. Haushalter that I'd like to speak to us when they can come on. As you know, we're currently in the midst of the third surge of the COVID virus and the COVID pandemic. And we are in the position to where we're getting very close to overwhelming our healthcare system. Deaths are rising exponentially. Hospitalizations are rising exponentially. And unfortunately, the most effective means that we have of combating this, such as shutting down weddings and wedding receptions, large funeral gatherings, large church services, are no longer available to the health department in their armamentarium because they've been removed by the governor. That leaves our health department with a really tough choice, because the things that they can do are they can close businesses, they can close restaurants, they can close businesses, they can limit crowds at athletic events. And that's pretty much the tools in their toolbox at this point. So last Friday, the medical advisory team of Dr. Jane, myself, Dr. McCullough, Dr. Randolph, and Dr. Haushalter met to look and figure out what we needed to do. Is there anything we could do? And we realized that what we have probably will not be totally effective or as effective as the last sort of safer at home order that we gave. But we felt to do nothing would mean hundreds of people that possibly could have been saved won't be saved. And also hospital systems that possibly could not be overrun and be able to keep our mortality rate the lowest in the state could be maintained if we use the levers that were available to us. At that point, you know, I think the health department was looking at, do we just close all the restaurants and shut down small businesses? And, you know, over the weekend, talking to businesses, talking to restaurants, it was felt that it wasn't really as effective doing a complete closure as it would be just to send a signal by moving restaurants from 50% to 25%. And then what they did was they moved all business, including big box stores and grocery stores, down to 50%. And we sort of felt this was a way that we could send a message to the community that what we wanted you to do was, if you're going to get the restaurant food, take it out. If you have to eat there, let's make it safer for you by going to 25%. In a community pandemic, we can still see spread in restaurants, and we wanted to not close them down and give them the ability to function for 4 weeks. So what we're looking at is 2 viral life cycles, and that should be enough to calm it down and give us, at this point, 6 to 8 weeks of being able to get the vaccine into the most needed populations, which are nursing homes, retirement homes, and healthcare and first responders. So that vaccine is coming. So I'd like to turn this over to Dr. Haushalter to explain this and to give her explanation. But most importantly, what we felt as a task force, or as the docs talking, is that we need to back the health department. They've been receiving death threats and all sorts of things for trying to keep our community safe. And we felt if all the branches of government said, we're going to back the health department trying to help our citizens with the tools that they have, however imperfect they are, we need to back them. And that's why I've put this resolution forward, because I think they've done a hell of a job at the health department, making us one of the safest places in Tennessee. And we need to listen to their expertise and back their decisions at this point. And I would encourage us to try to get a bipartisan group doing this, because this is not a partisan issue. Dr. Haushalter, could you possibly give us a presentation and tell us where you're coming from as a health department?
Sure. Thank you, Dr. Warren, and good morning, everyone.
Good morning, Dr. Haushalter.
Good to see you. I appreciate the opportunity to be here. Dr. Warren's done a really great job of succinctly saying where we are in the pandemic. It's not just where we are today, it's where we anticipate being in January and February if we don't reduce transmission. Dr. Jane's going to share some slides in a few minutes that covers particularly what deaths will look like if we continue on the current trajectory. And then there's a few other contextual things that I wanted to highlight, and they complement Dr. Warren's comments. In an ideal world, given the amount of transmission nationwide, a national strategy is what's needed. If there isn't a national strategy, we need a state strategy. And unfortunately, we don't have a state strategy, and that's in part because of a fundamental belief that local municipalities should make their own decisions. So that does mean that the actions we take locally have to have significant impact. They may not be as well received because we might have a neighboring county or a neighboring state that is taking completely different action. So we make sure, in part because of that, that we have a very robust decision-making process. And this really isn't happening anywhere in the rest of the state. Many of us may have different backgrounds, different philosophical or political beliefs, but we have a lot of dialogue and debate to come to what is the best recommendation locally. And Dr. Warren highlighted that. We knew probably 3 to 4 weeks ago we were headed in a really upward trend and anticipated Thanksgiving would make it worse. So we began having those discussions of what can be done, what can realistically impact Shelby County, even though we know there are things happening in the surrounding counties. And so that's what brought us to the health directive that we currently have. We haven't historically asked the city council or the county commission to support the health department. But one of the things that I believe, and I think Dr. Warren and Dr. Jane do as well, elected officials really are trusted leaders in the community. And so if elected officials also speak up and say, we're urging you to take action, that complements voices from healthcare systems and public health. So this is as much urging the community to take action to assure that Shelby County is as healthy as it can be for all of its citizens. We know some communities are disproportionately impacted by COVID. So to me, this is also a statement of unity that we're in this together. that it's, again, not just elected officials, not just public health, not just healthcare, but this is a difficult time for Shelby County, Memphis and Shelby County, and that together we'll get through this. So I really hope that you'll consider the resolution. And again, I appreciate the opportunity to be here. And I want to publicly thank Dr. Warren, who's your colleague on the council, who's been really integral in helping us move things forward locally. And I'll pause there. Thank you.
Thank you, Dr. Householder. Is there any questions for Dr. Householder before she has to go?
I see one person in the queue, and that's Councilman Morgan. Councilman Morgan?
Or just specific for Dr. Householder, or in general towards the debate and questions for this whole resolution?
You can go ahead and ask any question you like.
Okay. Everybody wants to be as supportive as possible in any efforts to contain the spread of COVID. This is a terrible virus. I'm immunocompromised. My wife and I have basically been isolating. We're taking whatever protective measures necessary since March. And everybody here has people that have been affected by this, friends, family members. But, a lot of what I hear today is again, it's more about the psychological play. Honestly, we've got people in the community that aren't doing what they're supposed to do. They're not asymptomatic, they're having symptoms, and they're continuing to go about their normal lives, going to friends' houses, Thanksgiving meals, going to places of worship and spreading disease. And I hear a lot of frustration, and there should be frustration with people that are doing this within our community. It's kind of self-inflicted. We have a number of businesses that aren't enforcing protocols that still need to be cracked down upon. We don't have a national standard for how to address this, and so it is left up to the local governments. But there still feels like a lot of, I think, questions that are unanswered. And out of the frustration that we feel about our lack of being able to control or contain the spread, I think there's an effort or an energy or movement to do something. And that something will then have a psychological impact that will crack down on the people who've been, for lack of a better term, I think, bad actors in this. And so one of my questions, this directive is not just urging and encouraging people. It actually has restrictions in it on businesses, 50% on retail, 25% for restaurants. If we're going for that psychological impact, what's the difference between 25% capacity of restaurants and doing, say, 50% capacity of restaurants? Because the impact to them is whether or not they stay open or close down. But the psychological impact probably wouldn't be all that different. Why 25% capacity instead of 50%?
That's a great question. And then before I answer that, I just want to say that from the health directive perspective, it's not just for the psychological impact. It's based in epidemiology and what is likely to reduce transmission. So a lot of people want specific data on an individual caught COVID at this restaurant. And that's not really how the data can be looked at, because there's a 14-day window where people can be infected and they go into a lot of different places. So we actually look at something in public health we call the epidemiological triangle. What's the interaction of the virus, the host or potential person who can get sick in the environment that they're in? And in using that, we make predictions on what will reduce transmission. So an example that gets used a lot is you wear a seatbelt in a car, because if you have a car crash, what'll happen. So we know that inherently restaurants are higher risk because they're indoors. They tend to be smaller space compared to a big box store, and people take their masks off. Social distancing works, masking works, but when you're in a very sort of upward curve, you want to reduce the amount of people in the space who can be infectious to others and those who may become infected. So the ideal really is to close indoor dining, but the middle ground is to go to 25%. That way you have a less number of people in the overall space, you have increased social distancing, but then you also have a lower likelihood of someone being infectious and others who could be at risk of infection. So that even if there is some transmission, it's at a much smaller scale than if you had 50% in the restaurant. Down to Dr. James, you want to add to that from an epi perspective?
No, I think that's fine.
And I watched the debate at the county commission last night as well on this item.
Should we let Manoj present if you've got general questions, or is this still for Dr. Haushalter?
This is still Dr. Haushalter from the health department. And one thing that I think is extremely important to note for the media watching or anybody watching this at home, we've been getting a lot of emails and calls about this issue. And because we're voting on it, I think a lot of the public think we have a direct say in what's in this directive, that we have approval or disapproval authority, which we don't. Whatever action we take here today, it's a supportive measure. It means absolutely nothing, to be perfectly honest, in terms of what gets enacted and what doesn't. And so this is one of the things that frustrates me as well. Is so the health department comes asking for our support. I understand why they want it. And they want it in a political way, in a unified voice. We have been offering the city, we have been offering our support all year long in terms of financing, in terms of people, in terms of a task force. And so one of my questions is, why was the $8.7 million for contact tracing not a penny of it spent? Why, when we offered 50 city employees to help, that offer was rejected as well? I think that we were told that they only had space for 10 people. And then, we had a task force that was a partnership, working on all the issues related to COVID in Shelby County. And that was basically disbanded under threat of lawsuit. So, I mean, we've made efforts to have partnership and support all year long. And when, very tangible things in terms of, people, financing, and now that was all rejected. And here we are asking for political support, not on Directive 1 through 15, but number 16.
Madam Chair, could I?
I'm sorry.
Jeff, please allow Dr. Householder to respond.
I appreciate the question. I would honestly say, Councilman, there's some things that you've said that are not consistent with my perception. So I want to make sure I'm clear. The Joint Task Force is operational. We meet every Tuesday and every Friday. There are multiple subcommittees under that Joint Task Force, and I participate in those as well as representation from the city. Chief McGowan and I work very, very closely together. And then we have, and when I say closely together, that's really in trying to convene groups, lead groups, get feedback. An example is we have other ad hoc groups that'll meet. More recently, we knew there was a need to prepare for the surge. I'm a nurse by training. Chief McGowan had connections in the healthcare system. I had connections in the nursing school. So we've been convening a group that's a surge capacity group. So the impression that the task force disbanded would not be an accurate one. We work very closely together. And then for the health directive specifically, we have conversations within our medical group. So that's the individuals that Dr. Warren mentioned earlier. Dr. Jane represents the city on that. I see Dr. Warren as representing the city, but the council as well in those conversations. I can assure you, we text and call each other all the time. So from my perspective, we have a very collegial relationship. We may not always agree, but we come to some professional discussion and come to a decision. So from my perspective, the task force is well underway. We also then meet with the mayors for each health directive. And as I shared with the commission, if we have a mayor from the city of Memphis and all the municipalities, and Mayor Harris convenes that group and we present our recommendations and they provide us feedback, my assumption is they're presenting and giving input from their municipality's perspective. So I think there's input in that direction. The 50 employees over time, so in the very beginning, and I don't know if you know our facilities or not, and that's part of the issue. We are in a 1950s building at 814 Jefferson. When we stood up Incident Command, we generally used 1065 Mullins, which is that old hospital building that is very small. we had to take some old space that was not being used, try to clean that out and put staff in and social distance. So we could not physically accommodate 50 additional staff safely during the surge. So we said, this is how much room we have. And literally myself and Dr. Randolph went in with the yardstick and a tape measure to measure off those desks because we were pulling items from surplus. So that was really an issue of space and safety of employees. But there were a large number of employees that were reassigned to us. I was thinking it was actually greater than 80, but they rotated through. All library staff got reassigned to us and a variety of other staff. And I don't know if I can ask Chief McGowan to give you an accurate number on reassignment of staff. Then HR assisted us with some recruitment efforts as well when we were able to stand up our own team through CARES Act funding. The other is, and I'm not sure where the 8.7 million comes from, Chief McGowan and I chatted about building up our COVID response team. That's before we had CARES Act money dedicated in the county. And we discussed 2.7 million as an amount to cover staffing. On the flip side of that, we were also building up testing, and the county and health department had agreed to give 50% of the cost of testing that was being funded through UT to the city to pay UT. Doug and I had multiple meetings with UT, and that was going to come to somewhere around 2.3 or 4, maybe up to $3 million. But when we started working on the contracts and the amount of time that was going into the contracts in the middle of a surge and in the middle of incident command, I actually elevated to Chief Gillum that we actually were balancing out, that we would receive 2.7 and give back about 2.7. And that in the end, it was probably more prudent to just pay for our own staff through our own CARES Act money and then take the balance of what was extra in the county and pay that directly to UT. So that, and that was conversations between Chief Gillum and Chief McGowan and myself. And so ultimately what we chose to do is not exchange any funds, each keep their own funds and agree on what the work would be, particularly around testing and contact tracing. And then we paid directly to UT in the amount of $400,000.
Does that
I know
conclude
it sounds
your
like a lot of going back and forth, but that's what happened.
The 8.7 million was what we'd allocated from contact tracing. 2.7 million was just the first payment that we were offering. And so to the contact tracing, one of the numbers that this council heard last week was that 70 to 80% of COVID transmission is happening in the home, 2% is happening at restaurants. Is that a national or a local number? Do we know of the 60,000 cases in Shelby County where and how they, contracted COVID?
No, and that is actually very difficult to calculate for a variety of reasons. One, it's airborne, so you can't see it. We don't do DNA fingerprinting on the virus locally, so we can't connect one case to another by a fingerprint. We actually do that in TB. We can say this person's TB was linked to that person's TB. We will know if someone was a contact to a known case. So in that case, you can say, husband X was the direct contact to wife Y, and that they gave it to each other. But that's actually a very small number. And the contact tracing, the way the system works in the state of Tennessee, so we're an independent metro, but we still have to utilize the state databases. The database that the state used actually had very limited information to help us discern where people may have been during their infectious period and where they may have been during their exposure period. So what we did locally around September, we launched an additional interview tool to help us discern some of that information. But what we actually have is a broader set of data. So we know that if an individual is infectious for that period 2 days before testing or 2 days before symptoms, they continue to work and continue to engage in social activities. So we know that people are in public places, including restaurants, when they pose a risk to others. So that's the data we have to use, and that informs messaging as well. And then we look at where people were during their exposure period. So that's more of a percentage. We know that, and I don't have the numbers in front of me, so I apologize. We know X percentage of people during their exposure period were in restaurants, specifically that they were eating in restaurants or they continued to socialize. So when you hear someone say that 70% or more are from household gatherings, I would challenge where they've obtained that information. It does, what we know is it is social interaction in a variety of settings when people are taking their masks off, and that we really have to discourage that social interaction. And we know that people who know each other become very comfortable and take their masks off because they're comfortable with each other. So I'm sorry, that was a long answer, and I hope I answered you.
No, it's all right. I got that number from another doctor that's on this call. But I agree with limiting social interactions. I don't agree with everything the governor's done. I wish we had more restrictions in place, but I want the restrictions that are put in place to be effective. And we're in an almost impossible situation with what I think is a vote that's ultimately meaningless, where people are so divided on this issue, where we're either going to be voting one way and they think we're going to cause more death, or we're going to be voting the other way and we're going to be causing thousands of people to lose their job. They might have protections from eviction, they might have utility protections, but they won't be able to make that car payment or that mortgage payment or whatever else other bill that's coming down the line. And we would be contributing to what is already a terrible poverty problem in Memphis. So I don't know why we're here other than to have just an additional debate before Christmas in 2020. I know y'all want support and that y'all have been getting these emails and tough questions and I think unfair accusations against y'all as well. And y'all are in a difficult position trying to do the right thing. But to have an emergency meeting to vote on this just feels like a misfire. Thank you, Madam Chair. I may come back later with additional questions.
Okay. Councilwoman Johnson said she will call in. If the staff would let me know when she calls in, we'll take her question. Councilwoman Rhonda Logan.
Thank you, Chair. And good morning, everyone. I'd like to know if you all considered the length of time. Has there been a thought to maybe have the end date or revisit date in 2 weeks as opposed to just putting it as 4 weeks?
So I've said publicly, we will relook at it. Actually, we look at it daily, and we're open to looking at it again in 2 weeks. But we do anticipate that it's going to take 2 incubation cycles to be able to see a decline. At the very beginning of the pandemic, it took us a little bit longer than that, but we saw a significant difference after 2 incubation periods. But we will reevaluate, and it's possible in 2 weeks. Like one of the questions we had is, could we increase capacity in the restaurants back to 50%? And we would be open to considering that, yes.
Okay.
Does that conclude your questions?
Yes, ma'am, it does for right now.
Okay. Thank you. Councilman, Vice Chairman Frank Covet.
Thank you, Madam Chairman. Can everybody give me a thumbs up if you can hear me? All right, cool. Just making sure that my new little headset thing works. Dr. Householter, just right off the top, I cannot imagine the hell that you must be going through with the data, in that you have an obligation to public health, and at the same time you understand about putting people out of a job. I mean, I sympathize with you, okay? But I also have to look at the restaurant industry and specifically how, and I get it, because originally the talk was a complete shutdown. And I assure you my tone of voice would be radically different if that had happened. But and I also get that the real culprits in this question, the family and social gatherings, I mean, that's the real culprit here. I mean, at the end of the day, we're using, I think what Doc said, the tools in our toolbox to limit as best we can. But we're also admitting that we're not going after the real big numbers and the big culprits. The concern I have, and this is just the first of the questions, and I'll come back. The concern I have is New Year's Eve. All right, everybody's going to typically go to a restaurant where they're going to have fun and it's safe and they're masked up and there are requirements. If we put down a 25% on the restaurants, people are going to gather in their homes. And the odds of them not masking and socially distancing, I would think, increases dramatically. I mean, would that not be a fair assumption? So I guess my question is, the 25% on restaurants, why can't we consider 50%? If for no other reason, people are still going to party. I mean, they're going to still want to get with their friends and hang out. At least they'll do it in a fairly safer environment. Doctor, what do you think about that?
So I stick with the 25%, as I noted earlier, and that's just because of the number of people in the space and where we are in the pandemic. And the health directive, there is a focus, I think, and as rightfully so, on the restrictions to businesses. But we consistently message to individuals and families, and we consistently message to employers as well. So we're really encouraging employers to have people work from home. We're really encouraging families to make sound decisions about what they do over the holiday. We do anticipate that not everyone is going to listen. And that's part of the focus on a unified voice is that, and I always use myself as an example, I have a very large family. We're not celebrating. And so it's really trying to address all of those areas. I think publicly, the focus becomes on the business restrictions, but we actually focus in all of those key areas. And I just want to address enforcement for a moment, because those are things that you're probably not as familiar with. There are many restaurants doing everything that they should, but I can assure you by the man hours our staff put in, if there's a way to work around it, there are restaurants that are working around it. I could name some, but I'm not going to, but these are ones that are individuals that I know are part of the advocacy, where an example of a restaurant that we continue to receive reports that at 10 o'clock, they lock the doors on the first floor and send everybody to the second floor. They have blinds down so you can't see anybody. So we literally have had to send people back over and over and over again, ask the police to go by so that we could confirm that they actually were doing that before we closed them down. When you have one business like that literally has hundreds of patrons coming in that are not wearing masks, it really poses a significant risk to the rest of the community. And many of these are in very congested, high populated areas. So we really are trying to focus on all key areas, again, not just businesses, but then also to continue contact tracing and to continue enforcement so that all of those together can help with containment. It's no one silver bullet.
So
I agree, and I would agree further, drop the hammer on the bad actors. But at the same time, the restaurants that are complying and are doing the right thing, I'm very concerned that our mom and pop businesses are going to go out of business. And at the same time, show me the data. And the data that we keep hearing is everybody's going to stay home and congregate. And we know that that's probably going to be a lot less safe than being mandated at a restaurant. I mean, 50% at a gym, but 25% at a restaurant. Again, I'm not in the attack mode. I'm being very sympathetic to you and what you have to do. But I will always say hammer the bad actors, but the vast majority of the restaurants are doing the right thing. And we're potentially putting them out of business, and we're potentially sending everybody home. And they're not going to mask up at home. But I tell you what, I'll save my questions because I see other members are in the queue. I just wanted to at least ask that beginning question. Thank you.
Right. So we have another presentation by Dr. Jane, and I have Councilwoman Cheyenne Johnson on the call. She's trying to get to another meeting. Can we get her questions, hear Dr. Jane's presentation, and then we'll continue with the members in queue. Cheyenne, are you available?
Yes.
Okay.
Excuse me. Can you hear me?
Yes, we can.
Okay. Thank you so much. My concern to it, I'm very supportive, and I understand the need that we have to be protective of all the citizens. But we also have to realize that through this pandemic, we're going to have to live through it. I have received numerous phone calls, and people have stopped me in the street, emphasizing, please do not close down the business. And I've heard the comments of my other colleagues, and I'm supportive of their comments in regards to the restaurant. We need some adjustment, in my opinion, in regards to closing the restaurant. If restaurants are out there and they are not working in accordance to the guidelines, then we need to just shut them down. Maybe it's a possibility to say if you're caught out of compliance, you get one opportunity. Otherwise, you're shut down. But I'm pleading on behalf of the restaurants and the employees, which I've talked to, that work in those restaurants, who say that if I leave, I won't have any health insurance. What happens then? What about they may get some unemployment, but they're saying I'm still need to pay my rent. I'm dealing with a possible of eviction notices. There's more than just the restaurants being affected. We're dealing with the suppliers. We're dealing with the Uber drivers. Everybody, transportation is being affected for this particular issue. So I'm in support of coming up with some directives, but I think it's a little harsh to place 50% on the restaurants, especially knowing that you can't do anything about the serious large gatherings in regards to the churches, funerals, and wedding situations. So are we truly looking at the issue? Should we not be dealing with more behavioral issues than necessarily closing or asking them to shut back an additional 25%? And those are my general comments, and I'll get back with you as soon as I make a stop at point. Thank you, Chair, for the opportunity.
I'm sorry, my mic was off. Thank you. Doctor, did you expect a response?
You speaking to me or the council?
No, Council Lady Johnson.
No, I'm not expecting a response. I just wanted to express my concern for the businesses that's going to be affected by the recommendations in that particular last directive. Thank you.
Thank you, Councilwoman Johnson. And we're going to move now to Dr. Jane. Dr. Jane.
Sure. Thank you, Chairwoman Robinson. And I'm going to actually just address the issue that Councilwoman Johnson and Councilman Calvert had addressed. Begin with this. I think the very issue is human behavior is very difficult to predict. Will people be going at home or going to a party on New Year's or staying at home, where they will mask and where they will not mask? It is going to be difficult, if impossible, to predict. But as a doctor, I have to deal with this every day with my patients when I give them a pill for high blood pressure or for HIV. It is going to be dependent on that very patient and their behavior. But as our role, both as public health leaders and political leaders, is to create an environment in which they can be most successful and have an opportunity to be as healthy and well as possible. So with that as a comment on that, I want to take a few minutes and talk about some of the science and the potential impact. It is really hard to project what will happen in the next 2 months. However, for many of us who study and do this every day and talk about it at the World Health Organization, WHO, and with colleagues at Center for Disease Control, I want to take knowledge base and with one of my other colleagues from UT and share with you the very question that has been asked of us time and time again is what is going to happen in terms of the mortality in our county over the next 2 months. And if you could see my slides, are you able to see my slide sets? My screen?
Yes.
Okay, so I want to take about...
Dr. James,
yes.
if you could, you have two screens?
Yeah,
Yes, there you go. Perfect. You fixed it.
Okay.
Thank you.
All right. So in about the next 5 to 7 minutes, I just want to do is to sort of help you understand from the science perspective what we're talking about in terms of the impact of COVID over the next 2 months. So what Dr. Fritjof, Thomas, and I did was to look at if we had to project the COVID deaths in Shelby County from December 2020 to February 2021. And the question we addressed was how many deaths may occur in Shelby County from December 18th to February 18th. And we took other regions, the most hard hit, worst scenario, North Dakota, as you know, and their epidemic curve and calculated the number of cases that we could have. And we applied the Shelby County mortality rate, which is actually much lower than the national rate. We're at about 1.35. The national rate is about 1.8. And we applied that curve for the cases and deaths. And we said, what would it look like? Then we compared that worst case scenario with possibly the same and better outcome scenario as well. So here is what we have. And let me just walk you through quickly. In the dark blue is what our present number of cases per 100,000. So what we see here is about 750 or 75 per 100,000 cases are occurring in a population of about 1 million. And this is our epidemic curve, as we call it. In lighter blue is what North Dakota went through. And if we walk back 2 months, this is potentially what we could go through. And so what could Shelby County look like in the next 2 months in terms of cases? And this is what we've come up with, is if we tracked that same curve, then we're talking about cases per 100,000 going to close to 160, 170 per 100,000 cases. It would last for about 2 months. But all these are cases, but how do they translate into the deaths, which is so critical? And I'll take a moment and talk about each day as an infectious disease doctor, I'm seeing 1 or 2 deaths that are occurring. Now, I'm just one of a dozen other doctors. Dr. Threlkeld is there, Dr. Cleveland, a number of others are infectious disease doctors who are seeing the number of deaths. What we want to do is to look at what is happening in a broader epidemiological cumulative sense. And what we're seeing is the number of deaths so far, about 802. If those number of cases in North Dakota were translated into the Memphis epi data, what we notice is this is what the curve would potentially look like, meaning the number of deaths would essentially double in Shelby County in the next 2 months. That is why the public health individuals, including Dr. Haushalter, are all quite concerned of what is to come in the next few months. Now, here are potential other scenarios. And these are, again, the daily number of cases. And this is the North Dakota data that if it happened in Shelby County. But if we were able to maintain the same number of cases and not let them go, this is what the curve would look like. And then if we were to improve and cause a decline, then this is what the potential cases would look like. That translates into some concrete numbers. The worst case scenario we're talking about 16 deaths a day for the next 2 months. If the same number of cases are there, we're still talking about 11 deaths. And if there's significant improvement, and actually that level of improvement is the same flattening of curve that we have already done previously in August of 2020. That means we would be decreasing to about average 7 deaths a day, which is nearly half of what would have happened. And that's what our hope is, to be able to bring the general population to understand we have done this before, we can do it again, we can flatten the curve. And the beauty is, this is the last time we will have to flatten the curve. The vaccine is here and will sufficiently help create some level of herd immunity that will not force us to have another wave again. And that's why it is so important to keep this in mind. And so recommendations from with public health actions, mandatory masking, increased restrictions, the required closures, which are CDC suggested mitigation strategies, which can help us in the number of cases and reduce the number of deaths as well. So I'll pause with that. I share that presentation as a chance to look at broadly what are the implications of the cases going up with not having some mitigation measures in place. So I'll pause.
Thank you, Dr. Jane. We have several questions for both Dr. Householder and Dr. Jane. Councilman Jones.
Thank you, Madam Chair. Mine are more so comments versus questions, but some of them are in response to previous comments that have been made. I think that we have to apply, we're in a desperate situation, let's just say. And in a lot of sense, we just have to apply common sense principles to this. And I will, in this area, I would defer to doctors Householder, Dr. Jane, and Dr. Warren in this, but I don't need them to apply common sense. So if and please chime in and correct me if I'm wrong, and these are just assumptions that I'm making here, and for what we've been told and what I've read. If a typical restaurant is not going to be of the same size and scale of a grocery store or a large big box type of retail or any other retailer for that standpoint. And when you're in those places, you are a little bit more mobile than you are in sitting at a restaurant. So if in an analogy that I've used, and correct me if I'm wrong, doctors, I think about cigarette smoke, and as it lingers, you can be stationary, but that smoke can find its way to you. However, if you could see the smoke, if you're mobile, you see the person that's smoking 10 feet away from you, you can take an alternate path and avoid what that smoke is. And so I liken what would be the fine particles of this virus to cigarette smoke. You don't see the smoke, it's disappeared, but you still find that smell. And I think that that's how I'm applying this whole concept to what we do in our individual behaviors as we approach, as we deal with this. So if I'm sitting at a table and that virus is in that restaurant, I feel that I'm at a greater risk just by sitting there, that it can find its way to me if I'm mobile in a grocery store and in a larger area or larger space. So, and maybe I'm wrong in my thinking, but that's just how I'm approaching this from what I've been told, what I've read, and what's been discussed over the past couple of months in dealing with this. If we were to go to, we know that we can, if people are being objectionable to being told to wear a mask in public, they would have a hissy fit if they were being told to what they can do in their private home. If we're talking about personal liberties and wearing a mask out in public, they've made a big cry about that. So if we want to dictate what they do in their private homes, then we know that we cannot control what's taking place there. And there's no way at all for us to legislate what the behavior is in somebody's house. But if there is that gathering takes place on New Year's Eve, whatever the case may be. But I still see that as a personal choice, that people who choose to go to a New Year's Eve party, that's a personal choice that they're making. But we don't have to make public places as accessible to them for them to potentially spread the virus. So what we want to do, and so, we're in a tough situation, and colleagues, I regret that in making some modifications to the available funds last week, that we've helped an organization. I hate that we didn't have the foresight to maybe set some of that aside for the hospitality industry, for the restaurant. So that made me think about a question here. And I don't know if there's anybody on the administration that can answer this. Are there any, with the most recent stimulus, well, not COVID relief package that was passed in Washington, are there any deadlines as far as spending that money? I know we don't have any additional funds for local government, but was that December 30th date extended on how we can spend that? If it is, I would ask that we go back to the drawing board. Now, and I'm saying this because I don't know this. We go back to the drawing board and we look at these restaurants. We look at the workers in these restaurants, and I still don't think, and philosophically, I don't think that we use short-term money to pay long-term obligations. I go back to for us dedicating everything to payroll when we have immediate needs in our community. So if there's some way we can go back and readdress that, if we have given some, if the restrictions have been loosened as to the time frame to expend those dollars. And people, when this first happened, and when a lot of this is the leadership from Washington, when we got to this, and based upon the information that Dr. Jane has presented us, we could have 100% more deaths. For those who are questioning this, I'm just going to plainly ask you, pick which one of your loved ones you want to sacrifice. There's not a damn one that I want to sacrifice. So we have to take whatever precautions that we can as community leaders to try to go against what this tide is and see the trends and the trajectories that we're on. To have close to 1,000 deaths, 1,000 new cases, that's just going to increase the number of hospitalizations, and those increased hospitalizations are just going to increase the number of deaths that we have. And I think that sitting back and doing nothing is not an option for us. Thank you, Madam Chair.
Okay, thank you. Councilman Morgan.
Thank you, Madam Chair. I agree. I wish we could do more. I want what's being done to be effective. We also know positive cases are going to the hospital, and there's some spread at hospitals, even with all their protocols in place. But we don't shut down the hospitals because we know that would do far more damage than it would good. And so that's what we're trying to balance. We know there's going to be economic damage. I had a restaurant owner call me on the verge of tears, asking me which employee of his would I fire. Would it be the single mom? Would it be the guy who's been in and out of prison and is trying to get his life back on track and finally has a steady job? Would it be the person who's 1 year out of college and is totally crushed by student debt? There's a real impact on that side as well. And so the question is what we're doing necessary, and then is what we're doing going to be enforced as well? And so that's actually my next question, is about enforcement. And Councilman Colvett touched on it a bit, but Dr. Householder, you said something that surprised me a bit about the restaurant that was closing their blinds, and you had to keep going and checking on them. to make sure they weren't doing that. How come if a restaurant is purposely violating our COVID protocols, why don't we just shut them down? I have no sympathy for anybody that's purposely violated. Same as if they were purposely serving meat that they'd known had gone bad. Why do we allow the restaurant to continue to operate?
Yes, sir. One, let me speak to that specific one because I think it's a great example. First, we don't have difficulty shutting a facility down. When we began to focus very heavily on enforcement, which was many, many months ago, the goal was engagement, education, technical assistance, and then move to enforcement, which would be closure if there was no other option to try to bring them into compliance. But the restaurant that I'm speaking of, the reason I think it's a good example is one of my lessons learned through this is I can only imagine what prohibition was like. So we had staff who actually sat outside of that restaurant and they knocked on the door. No one answered because someone had tipped them off that we had staff there. We had staff going at 5 a.m. to see if we could see anybody leave. So we can't act on video that gets sent to us. That's considered hearsay evidence. Those of you who are attorneys will know that. So we get a lot of video in complaint, but we actually have to confirm it on site. So this particular facility knew when we were coming, however they knew that. We would continue to pop in and out all night long. We understand they were running from 10 to 5 in the morning, but it literally took probably, I'll estimate about 2 months to actually catch them. And I hate to use that word, but that's literally what it was. We had to have the evidence to be able to shut them down, and they were subsequently shut down. There was an incident this past weekend, and MPD helped us with that significantly. There was a party advertised at one limited service restaurant. Staff go there to the front. It looks like it's not open. In the back, so they had to go back into the back alley. There's a bus back there picking up individuals. Those individuals crowd on the bus with no masks on. They get driven over here to Madison and enter 2 other clubs to have a party. So there is a lot of workarounds. So we don't have any trouble closing anyone down. It is making sure we have sufficient evidence to do that, and also not trying to, sometimes it's an error. Like someone may not know that they were supposed to do X or Y, and that's more of an educational approach. And then yesterday in County Commission, we also asked for the authority to give a citation so that there was another option before complete closure, and that could be a citation for every violation, particularly of non-masking. And then I think there's also a perception that even with the closures, the focus is on restaurants and limited service restaurants, but it really applies to any facility. If we get complaints on a grocery store, we follow up on those as well. If it's a business and an employee calls, we will follow up, but we also then encourage those employees to go to TOSHA. So we really don't have a challenge doing that, but there is a lot of workarounds, interestingly.
I know it's difficult for restaurants that are trying to follow the protocols and do what the directives say, and then they look across the street at their competition, which is reaping profit from being and just really flying in the face of everything that we're trying to do.
So we have encouraged the restaurant owners. We take complaints a variety of ways. They can actually come into the city or any of the municipalities, and they'll be transferred to us. They can go in through the mayor's action center here at the county. They can call us at 222-MASK or email us at Shelby TN Health. And even if we get a complaint on Monday that's from the previous weekend, we do follow up on those. But one of the things that's been consistent is we will hear restaurateurs say, well, I'm in compliance, but there's another one down the street that's not in compliance. And I will generally say, please give us that information so we can follow up. And they may or may not share that information, and more likely don't share that information. So for us to hold businesses accountable that are non-compliant, we really need everybody's eyes and ears to give that information to us so that we can follow up and do whatever appropriate action there is.
Okay, final question. I've talked too much. The governor's executive order protecting weddings, does that apply to wedding receptions and rehearsal dinners as well, or does it just say weddings? Because I think of a reception as being something totally different than a wedding. Wedding is over when the bride and groom walk down the aisle at the end. Why don't we just go ahead and shut down the receptions and the rehearsal dinners as well?
So the initial legal interpretation that was given to me is that their reception is part of the wedding, and therefore we are preempted from addressing that. There's been more recent conversation to explore that further from a legal perspective, particularly if the reception occurs at a different site. So there may be a different interpretation in the future, but the initial interpretation was that was all part of what the governor's office viewed as the religious service. Same thing would apply to a funeral and then any wake or subsequent activities post the actual funeral.
Okay, I've never seen the cutting of a cake in a religious text, but all right. All right, thank you very much. I really appreciate all the work y'all are doing. This is tough, and I'm absolutely torn on this particular directive. It's a difficult decision.
Okay, thank you, Councilwoman Logan.
Thank you, Chairwoman. And I too thank you all for the work that you're doing. I know, and this is a very difficult situation that we're in. You know, this year has been tough, but once again, we're here because we were elected to, represent and serve the people. So with that, I do understand this. I tested positive for COVID, and family members did as well. And it was initially, it was, very alarming. And I said that to say that this is very real and, has some serious long range implications. I'm grateful that I had mild symptoms, but there are those that lost their lives. And, every day that I was dealing with this, I was hearing that, and what that does to a person that has tested positive, only those that experience that can understand. So my thoughts about it now are very different from they were previously, because I too am sympathetic and concerned about the business community. I, wondered why we were focusing on the businesses initially when most of the contact I had seen or read about was from gatherings and large groups and parties and things like that. But while I was listening to the county commission meeting yesterday, it was said that those that are exposed in these in the homes or parties or gatherings, then they go out and infect others at the retail and different, things like that. So the business owner could be doing everything that they're supposed to do, but people that have been reckless and irresponsible and, are going out visiting these places. And sometimes you don't even know, you may not be reckless. I know in my case, we have been very cautious, but there was one time that we, let a family member come by, and they had been exposed, and they didn't know it, and they don't go out a lot. So there's so many different ways that you can contact it, and you don't know. So my view has changed because of the fact that I have a relative that was asymptomatic, and they were positive. They had no symptoms, didn't know they had been exposed, and they were, they could have been going out. Just so happened they were not, but they could have. So this happens all the time. So we have to do what has to be done. And I want to see us focus on how are we going to help the business owners that may have to close. How, as legislators, as elected officials, we have to turn our attention to how we can help. What can we do? What funds are available? What agencies are in place to help these business owners that may have to close or may have to pivot? We do have, I'm so grateful that we did approve the pivot program that is coming forward, that for those that have to maybe look at another career, we can help them manage through this process, because that's where it looks like it's going if we're having to shut down. I'm glad that that you all are gonna look at this in 2 weeks again to see if we can relax those things. Hopefully the curve will go down, but we have to be mindful now that all of our efforts have to be in helping the business community in Memphis and the federal dollars that are coming down. We have to make sure our state legislators and county, we're right in place to get those dollars and bring them home to the people that need them. The last thing I want to say is that I also heard concerning enforcement that the business owners that want to appeal if they receive a violation notice, that if they want to appeal, they have to do it through environmental court. Is that true?
That's only if for the citation. So
Right.
if we issue the fine, then there are due processes that they can have that heard in environmental court.
My concern is that environmental court is already so behind. They are way behind with cases that they already have now. In terms, they're having to continue a lot of cases, and the matters, their regular caseload, they're not even able to maintain, unfortunately, maintain those cases. So what other recourse, or are these cases going to have priority? How are we going to handle that? Because it could likely be that a business owner would have an appeal and may not even be heard or seen for months and months. So how is that going to be handled?
So we, in public health, we work with environmental court all the time and generally are able to get cases in a timely manner. Just for clarity, we're still working through all the protocol of implementing the citations. So we're not starting that today. We want to make sure we work out all the detail. Is that if someone is in the appeal process, their payment would be pending until that appeal is heard. So it's not like they would pay us the fine and then be waiting to get it back. If they filed an appeal in a timely manner, then we would wait for that appeal to be processed. But also, even with the closure, oftentimes there's an appeal directly to me or Dr. Randolph, and we will do an investigation ourselves and if necessary, overturn the decision of the investigator. We look at all the facts, but we also, again, try to make sure we have input from others to make sure there's no implicit bias that's occurred in making a decision. And how do we go through some discussion to make sure we're being fair and equitable for all, so that we do the investigation, but we may look at similar cases and make sure they were similarly treated. And then we can override internally as well.
Okay, so you and Dr. Randolph are investigating these, is what you're saying as well?
If there's an appeal, so an example is that a restaurateur, I won't name that restaurant, it was actually an event center, reached out to say that they felt that they were closed and that the data didn't support the closure. That appeal came to me and Dr. Randolph. We reviewed the investigator's notes. We interviewed the supervisor. We interviewed the investigator. And we said, in this case, we think education would have been sufficient. It wasn't necessary to close the individual's business. So go ahead and reopen. And we did that fairly fast. So we have the ability to do that as well.
Okay, thank you. I am hoping that we continue to stay on top of that, because that would just be, terrible if the appeal process even took a long time. So hopefully we'll be able to support that and shore up environmental court to make sure that those can get in a timely fashion. And once again, thank you for the work that you all are doing. I yield back, Chair.
Thank you. Councilman Warren?
Ma'am, I'm in the queue.
Okay, I thought Warren was right before you, Councilman Smiley.
Colbert, I know I'm not as good looking as him.
Oh, I'm sorry.
But thank you for confusing me for the young, good looking guy. I mean, that's a good problem.
So I'm gonna go back up here to the queue. We did Worth it. He had 1035. Then Rhonda Logan. I just got her. Then it says Dr. Warren wants to say something about deaths in the nursing homes. And then it's Smiley. And then Chase is gone. And then Frank. And then Dr. Warren again. Is everybody looking in the chat? That's what I'm following.
Madam Chair, that was just a comment to say, Dr. Jane, when he was talking about seeing deaths in the hospital, we're seeing them in the nursing homes too. That was just a comment. And I'll stay behind Vice Chair Colvett at the end.
Okay, thank you. Councilman Smiley, you now have the floor.
Thank you, Madam Chair. I was essentially agreeing with the comments made by Councilman Jones. I'm not trading any one of my family members, so I'm in full support of whatever decision that the expert tells us that we need to make. So that's all for me.
Okay.
And keep up the good work.
Thank you. Councilman Covett?
Thank you, Madam Chairman. I think we all agree nobody wants anybody to die from this. And I think we all agree that nobody wants anyone to lose their livelihood, their jobs from this either. Okay, we agree on all points, I think. I also think that we're focusing on these issues like we're focusing on some flies when there's a big tidal wave coming towards us. This resolution, the health department's already done what they're going to do, and we're voting as a show of support for them. Let's make this personal. I mean, let's add some teeth to this. Madam Chairman, I want to offer an amendment that all council members, in a show of solidarity and support for the restaurant industry, that all council members forego 75% of their pay for the duration of this mandate. I so move.
Morgan seconds.
We have a motion and a second.
Can
I
you
don't
repeat
see-
that? Can you repeat that, please?
Yes, please restate your motion.
The Memphis City Council, in show of solidarity and support of the restaurant industry, will forego 75% of their council pay for the duration of this mandate.
And how much would that total?
I have no clue. I just thought of it.
No fiscal note. Okay, thank you. And it was moved by Councilman Covett and seconded by Councilman Worth Morgan. Any questions on the motion on the floor?
I need to state that motion again. I want to make
Yes,
it
sir.
clear.
Yes, sir. I
Very
apologize.
clear. Make it slow and very clear.
The Memphis City Council, as a show of solidarity and support to the restaurant industry, agrees to forego 75% of their council pay for the duration of this mandate. So if it goes for 3 months, 75% of your council pay over 3 months, you're giving it back.
The duration is already stated in the resolution. It's December
not good.
26, 2020 to January 22nd, 2021. That's
I hope it only goes for 2 weeks.
Chairwoman, I'm in the
okay,
queue.
Councilwoman Logan, I'm sorry.
I like to know, I too would like to support whatever effort the body deems necessary, but I definitely want us to be responsible and intentional and deliberate in what we do, not just emotional. Exactly how much is that and what exactly we're going to do with it? How can they access those funds? And what is the resolution? What's going to happen to those funds? I want to make sure that there's equity in the distribution of them. So what are we collecting this money for?
Councilman Covett.
I would certainly be open to the will of the body if we all want to give it to charity, or if we all want to send it back to the city as and potentially give it out as grants to the restaurants. I'm open to y'all's good humor on that.
So I would suggest that, Chairwoman, I would suggest that we come up with a plan and present that to vote on.
Yeah.
As a, and how much that's going to be, or what is that going to be $10 a person? Is that, how much money is that going to be, and what are we going to do with it? I think we need to come up with that plan and then come back and present it and put those dollars forward, if that's what we're going to do as a body.
Yeah.
Maker of the motion.
I move that we hold that resolution until we come up with a plan and then come back and present the plan.
Second that motion.
The maker of the motion, do you accept that as a friendly amendment?
Sure.
Okay. So we're going to bring that back to the table so it does not require a vote. Thank you.
Chair lady.
Yes, Councilman Ford.
Yes, Councilman Corvette, I would like within the next few days, if you can, before this holiday come up, try to work on the figure.
Yes, sir, absolutely.
Yeah, then we can come back and then, like I said, I think everybody needs to know a figure. Now, not only that, I have nothing against these restaurants, okay? Some restaurants are good restaurants, some are bad restaurants. So, I mean, hey, we got to make sure that, hey, we helping the ones that's doing what's right. You know, when it goes back from the last stimulus, even though they're just trying to work on another one, you know, a lot of these restaurants, hey, they closed down for certain reasons. And the reasons why they closed down, hey, these people were getting the check, they didn't go to work. Say, hey, I'm getting more than this check, then why should I go to work? Okay? You got a lot of different issues when it comes down to these restaurants. Now, I haven't been in a restaurant since February. I refuse to go because all these restaurants that's serving food, they wouldn't go out of business. Chick-fil-A is doing very well. You got Olive Garden is doing very well. All this carry out. And if you want to go all the way down, Domino will bring it and put it in your truck. I have one person that's out here, hey, has a tremendous business. He did not take call-in orders. Okay, he closed his business. I know him very well. So, man, you need to go open your business and hey, and take these call-out orders. He decided to do just that. And hey, he hadn't lost a cent. Okay, but he was losing a lot of money when he didn't want to take no orders. Then not only that, if these restaurants and if you go and pick up food, everybody knows that's ordering food and all. I may be in the line 30, 45 minutes or an hour to pick up my food. So it's a lot more to it, you know. And then a lot of these restaurants that may be complaining, I've got a problem with it. Hey, it ain't about the food, it's about the liquor that they want to serve. That's where they make their money. That's why I want you to come back with some numbers. Because like I said, you got the real restaurant, they haven't lost much. And then, like I said, when that other stimulus, you had the people were getting more money from the stimulus every week. They just didn't show up for work. So it's a lot of different options here when it comes down. And then plus we really want to help the ones that's doing right and the ones that want to take advantage. We got to make sure that, yeah, we need to shut them down. And then, just to be honest, this is the worst strand coming around. Dr. Jan, Dr. Warren, y'all doctors. I'm an undertaker. Those numbers that you all give as deaths, you can just about double it, okay? Y'all are giving only the ones that's reported. A lot of them are not being reported, okay? I have 30 cases on my board today, and half of them are COVID. Every time I get a call, and we ask, and some don't want to tell us, okay? We have to force them. We have to go through records to see exactly what's going on, okay? But every time I get a death call, I say, I know it's going to be another COVID, another COVID, another COVID. That's why I mentioned Quince Nursing Home. If I get a phone call from them, oh, it's COVID. Automatic. I ain't got to ask them. And they're one that I turned over to the health department now. Y'all supposed to have been getting on them. I don't know what happened, but they're still doing the same thing, okay? Don't want you to know anything like that. You know, and that's why I keep saying I'm the first responder and I'm the last one because I'm the undertaker. And then, hey, when people come here, I have problems with people want to wear a mask. They won't get in my funeral home. You know, I have certain numbers in my chapel, and mine is, hey, really 20% of the people can come in. And if I'm having a viewing, you must come in, view, sign the register, and leave. You cannot congregate. I have problems. And like I said, I've had problems with families. So, well, we want this, we want that. I said, well, if you do, you need to go somewhere else. Because, hey, it's very, very important. And these strands that's out right now is worse than anything that we've ever had. Dr. Jan, you know that. Dr. Warren, you know that. You know, and like I said, a lot of these restaurants, everything else, they're not going to tell them. People don't want to come in there with a mask, and they're not going to say anything. All they want to do is sell some food. And it's kind of hard to buy some food in there because you don't know who made food. You know, last night they were talking about in the other countries, it came from a person wearing a mink coat. So, hey, you better have an old mink. Don't buy no new mink. And these are bad strands. I mean, but Dr. Warren, you know about it because, hey, you mentioned that to me last night. And then, you know, you kind of do studies. It's very important. And, hey, we, for the next 4 to 6 weeks, we got to have to just deal with what we deal with because we were low. Now look where we are. We just as bad as anybody else because people did not do any of the things that were supposed to have been done with our numbers. And I'm through. But like I said, I would like for you, Corbett, I get some numbers because, hey, I need them within the next few days because everybody needs to see the amounts and it may be a little bit different. Okay.
I look forward to working with you, Councilman. Thank you.
Yeah.
Okay, thank you. We have.
The reason why I'm saying that because I got a little money that I didn't spend. And if we could use it, council don't have to end up doing it. I had it for cameras, but they didn't put no cameras up this year. So why give them some money where cameras where they're already supposed to? So, hey, that money that I had, and then we can use it to help if we need to.
Thank you, Councilman Ford. That is a real good solution. Thank you.
And
I need to get the meeting back under control. We really need to call for the question. This is just in support of the resolution that the health department is already done. All the work is done. They're just asking for our support. And I need to leave and go see about my mother. So will you all please get back on track?
Only thing else I want to say, I need those numbers because you know I'll lose that money this year if we don't. So I want to make sure
those numbers down.
That's the only problem. I don't want to lose the money.
Okay, staff, will you please work with Councilman Ford and Councilman Covet? Thank you. I see Jones, Smiley, and Warren in the queue. And Worth, you're back in there again. Okay, this is going to be our last round. Calling for the question, and we're going make it to a vote and go home. Okay,
Chairwoman, I'll have to leave in about 5 minutes, but I was just going to make a comment. What Councilman Ford said is it's true that there are a greater number of deaths than what we are putting here, and certainly his experience backs that up. So the numbers that we are showing are much lower than what reality is likely. So,
okay, thank you. Morgan.
Thank you, Madam Chair. Yeah, just to Councilman Colvette's motion that's no longer on the table. I think it's a great idea. The math is we make about 30,000 a year. So 1 month of that would be 2,500. 75% of that would be 1,875. Multiply that by 13 of us, and you get a little bit over 24,000 before having any withholdings for taxes or healthcare. Would be about the amount of money if this Directive 16 were in place for 4 weeks. And I think it would get a lot of attention. I think it would get not just locally, maybe even nationally. And the more attention we get, the larger psychological impact I think Directive 16 has. The more people start looking at it, considering it, thinking on it, and maybe it'll sink in more. If the council's willing to forego the same percent of their paycheck as what we're doing for restaurants, that might have enough psychological impact to save lives.
Okay.
So I think
Frank,
it should be considered.
Excuse me, Frank, can you take over? I have to leave. Thank you.
Sounds good, Madam Chairman. If I don't talk to you, Merry Christmas. We're saying prayers for your mama, and Frank has the ball. All right, that was Councilman Morgan. Councilman Jones, are you still in the queue, or we want to go ahead and call the vote?
Can I ask a question, Morgan, first?
Councilman Ford, you have a question of Councilman Morgan, and then we'll go to Jones.
What kind of number did you come up with, Councilman Morgan?
So we make about 30,000 a year. So 1 month of that is 2,500. If you remove 75% of that, that would be 1,875. Now, again, that's not including withholdings for taxes or whatever healthcare plan you've selected. And if you multiply that by 13 council members, you'd have a little over $24,000 after 1 month of 75% withholding.
Okay, reason why I asked that, I have enough to really cover that if your numbers are correct.
Okay. I look forward to, again, Councilman Ford, look forward to working with you and working this one out. Anything we can do to help save lives. All right, I'm to Councilman Jones. You're recognized.
Thank you. When we implemented the mask mandate, one thing that it did not include was any type of enforcement. But what it did, it affected behavior. And so I think that we got the intended outcome just by implementing. So if we're looking to affect behavior here, I think that we don't necessarily have, and I expressed concern about us having a resolution or an ordinance that did not have any type of enforcement mechanism to it. I think that you don't necessarily have to have that to influence personal choice and personal behavior. And I think that we've done a good job, and we were on the forefront of doing it locally. I'm going to look at too. I received a text. I haven't heard, there's nobody from the administration that could talk to me about it, but someone who's listening into this indicated to me that we now have until December 31st, 2021, based upon the new law that was just passed either yesterday or today, dealing with this second round or whatever round we're on of COVID relief, that we have until the end of next year to spend this money. So colleagues, I'm going to hope that we go back and revisit our spending the money on payroll, that we look at that pool of money and reallocate that to the restaurants and the hospitality, to utility assistance. We do that in the next coming year, since we are not under that same time frame under which we were assumed that we were at the last meeting. So those are my comments. Thank you.
Thank you very much. I'd like to call the question, but I see Council Lady Logan is in the queue.
Mr. Chairman, I had a cue to close before we call the question, before you made your motion.
Okay, hold one. Council Lady Logan, you want to make a quick comment?
No, I retract. Thank you.
Very good. If Councilman Smiley is okay with it, I'm going to let Council Dr. Warren close us out.
I was ready for call for the question, but go ahead, Doc.
All right, Doc, you have the ball.
Thank you. One of the things that we didn't talk about scientifically was the effect of the row knot. We have actually, after Thanksgiving, the row knot has gone down from about 1.15 to 1.03. And if you recall this summer, once we get that row knot less than 1, the epidemic starts to go away exponentially. So we don't have to move the needle a lot to see a big change right now in what's going to happen with the disease process. So that's the reason the health department has recommended doing this, because they think it's going to be enough to make this spike blunt. It's the tool they have, but it's the tool that they think will probably work. And we can see it's beginning to come down. We do this little extra kick, it will work. I think we've all heard that we've got the ability to go back and help restaurants that are in trouble, as Councilman Jones said. So what we really need is a show of unity here, to where we're backing the health department. And, you know, I'm more than willing to go back and look at donating my 75% of my salary. But I think we should also realize that not everyone on the council has the same economic means. And we should probably ask for that to be voluntary for people who can afford it, and realize that it's not necessarily, some of this may be putting bread on people's tables. So that being said, I call the question and ask for us to please support this as a unified body. This isn't a partisan thing. And that type of support, I think, as Councilman Morgan said, will speak loudly and will make national publicity and definitely statewide publicity, because we'll be the first body that's actually voted in unity without any sort of political division. So with that, I call the question, Mr. Chair.
And I agree with your calling the question. I certainly hope the restaurateurs can do the same. All right, questions called, seeing no objection to calling the question. I assume you're ready to vote on this item. I believe it's moved by Dr. Warren. I do not recall the second. Was that Swearingen?
Oh, okay.
Moved by Warren, seconded by Swearingen. Val, let's do a roll call, please.
Councilmember Canali, Carlisle, Vice Chairman Colvette,
Abstain.
Easter Thomas,
Her vote is in the queue.
Yes, Easter Thomas is recorded as yes. Ford,
Yes.
Johnson,
Yes.
Jones,
Aye.
Logan,
Aye.
Morgan,
Abstain.
Smiley,
Yes.
Swearingen,
Aye.
Warren,
Aye.
and that concludes the vote. I think Chairwoman Robinson did leave.
All right, that motion passes. There being no further business in front of this council, may I get a motion to recess, please?
Motion to recess.
Who's my second?
Second is Smiley.
Moved by Warren.